ladies and gentlemen. Welcome back for the day 2 session of the scientific workshop on paper writing and publication. I do hope you all had a good time with the dummy manuscript and dissecting it to the core with the outcome already mailed for your analysis. Before I continue with today's workshop, I would like to begin with the feedback which I received from my colleagues. My colleagues, they were highly impressed with the lucidness and the simplicity of the entire workshop. As Dr. Vinod has put it, no jargons. So proceeding for the day 2, we have the same galaxy of speakers as of yesterday with a few jewels added for the session. We start with the first presentation will be by Dr. Vinod Ravindran. He will be speaking on editorial process and tips for successful publication. As we all know, we have met him yesterday and he is the editor-in-chief and he will be speaking on the editorial process and tips for successful publication. Moving on to the panel discussion, it will be in the sequence of Dr. Samir, who had spoken yesterday on the title, Abstract and Keywords, Dr. Molly, who has given us a beautiful talk on introduction, Dr. Sham Santhada, who gave us a talk on methodology. The next slide is for the panelists. We have Dr. Mohit, who detailed us about how to mention the results, the figures with the bar diagrams with the presentations. Dr. Durga, who gave us a good discussion on the discussion aspect of the IMRAD, and Dr. Kirti with the references. We move on to the speakers. We have the first jewel for our session, Dr. Rajiv Gupta. He is a prolific researcher, a preventive cardiologist, rehabilitation specialist. He is pioneer in coronary heart disease and has more than 900 publications to his credit. At present, he is the adjunct professor of medicine at Mahatma Gandhi Medical College, Jaipur. Out of the 900 publications, 600 original articles and 100 book chapters. We welcome you, sir, and he'll be speaking on publication, ethics, and authorship. Dr. G.N. Saxena, another jewel for today's session. He needs no introduction, but yes, he is an eminent physician, academician, and professor of medicine at MGMCH, Jaipur. He is also the Pro Vice Chancellor at present of MGUMST. He is a pioneer of telemedicine and has 150 publications to his credit. He is the co-founder of the Southeast Asian Institute for Thalassemia. Sir is going to speak on plagiarism and how to prevent it. Dr. Hemant Malhotra, we all know him, but he is the last star for today's evening session. He is professor and head Department of Medical Oncology, director at Shri Ram Cancer and Super Speciality Center, Mahatma Gandhi University of Medical Sciences and Technology. Dr. Malhotra has more than 200 publications to his credit and has authored several chapters in various books. He is one of the founder members and head of hematological cancer committees of Indian Cooperative Oncology Network. The next session will be by Dr. Vinod Ravindran with the take-home messages through the workshop. The vote of thanks will be delivered by Dr. G.N. Saxena, Dean, Research, MGMST, and the summary and closure will be by the program coordinator, that's me, Dr. Aparna. So over to Dr. Ravindran for the evening, and let's have a good feast for the knowledgeable feast. Welcome, Dr. Ravindran.
Thank you. I think we'll just start. Good evening. Apologies for the slight delay in the start of today's session. The fault was with my laptop, apparently. So what I'll be discussing today is the publication cycle, basically to give you an overview of what takes place or the sequence of events which takes place after you have submitted your manuscript to a particular journal. So basically, I'm going to bring to you an editor's insight into the manuscript processing. And I would be discussing various outcomes of your such submission to the journal, which could be a revision or a reject. And then I'll be discussing how you can actually deal effectively with the rejections and make the most out of it. Okay, so today in a later talk, choosing the right journal would be covered. As I said yesterday, it is extremely important that you choose the right journal for your work. Um, it is important to follow the instructions of the journal which you are considering your submission verbatim. And I hope you already know that for all different type of article categories, there are different type of guidelines which would be unique to a journal. And you must obey the requirements related to word count, how many figures your manuscript can have, and how many tables and how many references. It is important to adhere to that. When we consider what happens to a manuscript, so once you're submitted, uh, usually the manuscript will go through an administrative checklist, meaning whether it is complete, the conflict of interest declarations are there, financial declarations are there, the ethical approvals are there, consent is there. All those things will be checked by the journal administrative staff, and then it will be passed on to the editor-in-chief. So there are different type of workflows I have depicted here, where um, it could be either directly assigned to the associate editors, or it would be done through the editor-in-chief. Uh, I'll be giving you an example how the Royal College Journal handles your manuscript. So after the admin check, the manuscript is passed to the editor-in-chief, that is me. And based on so many things, a decision of immediate reject can be made, or it can be passed on to the associate editor, who also can recommend a straightaway reject, which of course, after my approval, would be passed on to the authors. In many scenarios, the associate editor would also feel that probably this manuscript merits a further review by the reviewers, and he or she will select reviewers and pass on the manuscript to them. And later on, the scores or recommendations with comments will be available to the associate editor, who will also make a final recommendation, and which has to be which should have an oversight by the editor-in-chief, and the ultimate decision would be probably of revision, reject, or acceptance. Okay, so coming to what decides the ultimate fate of your paper. So there are two bits, one is the editorial review. So this is important for the authors to understand that sometimes they submitted their manuscript like on Monday, and by Wednesday, there is a reject decision in their email inbox. If that happens, what one has to appreciate that every journal has the right to take on the manuscript which conforms to its need, the import to its readership, and the relevance to its overall sort of editorial views and the goals. In addition, the editor or the editorial board would have considered several technical points. But the bottom line is that you would see such a language in these type of straight rejections, which are called desk rejections, that we receive more manuscript than we can ever publish. Or it does mean, however, that we had to apply even more or ever more stringent criteria. And on this occasion, I'm very sorry to disappoint you. The key thing to understand is that actually please try somewhere else, because in all fairness, in spite of big misgivings on the author's part, the journal has decided that your manuscript is not even worth peer review. Okay. If your manuscript does go under peer review, the associate editor or the editor-in-chief himself or herself would be sending it out to one or more reviewers, depends. And of course, they will be independent of the author, and journals follow different policies as regards to the open peer review, where everybody knows everybody, or blinded, meaning the editors know who are the authors, but the authors would not know who are the reviewers. Or the reviewers would know who are the authors, but not vice versa. Or it could be double blind, or it could be totally open. Whatever is the process, the peer reviewers would be asked to comment on your manuscript, considering number of things. The purpose is to inform and advise the editors what should be done about your manuscript. So they would be asked to consider several different things. Okay, so some things are very obvious, like whether your particular piece of research has got broader implications or not. Has it got any relevance to practice, your clinical practice or society at large? That means scientific society. Has it got any scientific merit in it or not? Most crucially, are the methods used appropriate to the clinical question with which the research started? Does the paper has any new and significant information over and above what is already there in the scientific domain? What's the length of manuscript? Is it too verbose? The abstract is appropriate, whether the analysis are clear, results have been presented clearly, logically, and in desired sequence. What type of statistical methods have been used? So all these things the peer reviewers mostly consider before they make their recommendations. So two types of recommendations are available for the editors from the peer reviewers. So this is the bit you would get as a submitting author. So there will be a diplomatic overall opinion. The editors or the reviewers would comment on, your manuscript was of interest, and but there are few areas, which needs to improve. Okay, if you missed out citing or highlighting relevant works from your own area or similar work in the past, it could be gently and diplomatically referred to. The action point for you is to respond, understand and respond to the critique, answer the questions, answer the clarification sought, and take on board the suggestions for revising your manuscript, which has come forward or which has been put forth by the reviewers. And they would also flag up inappropriate references, like in yesterday talk you have heard from Kirti Talari that unnecessary self-citations have to be avoided. So number of interesting points would be available to you from the reviewers. Whereas there would be a totally different set of opinions and comments which are not available to you because they are confidential to the editor. And here they would be mostly very brutal. They would say that, I'm very concerned about the authenticity of this work. I'm not very sure whether the sample size calculation was done appropriately. And it could be anything which they would be hesitant to share with you for all the obvious reasons. And then they would be giving the final recommendations regarding your manuscript to the editor, which could be either a major or minor revision, straight reject, or accept. When it comes to you for revision, you have to be very happy, because this is another chance to redeem yourself. Your manuscript. It is important to consider the reviews in detail, thoroughly, and have a systematic approach in terms of how you're going to answer them and what type of revision it would lead to in your original submitted manuscript. I have few examples, but it is important that you start by thanking the reviewers and editors because they are doing voluntary job, like you, they are also busy clinicians and they are actually generally not paid for doing this extra work. Address each comment individually and provide a detailed response to each comment, as detailed as possible and as precise as possible. And you'd be often asked to provide a manuscript version which will have either the changes made in the manuscript um, highlighted or using the track changes tool. Some example. One is this one. Thank them and answer point by point. So you can see that it's very nice start. We thank the editor, all reviewers for their time and thoughtful comments. It is disheartening to see still when we have response from the authors where they say that it looks like that the reviewers have not read our manuscript properly. There is no point getting into tangle with your editors or your reviewers. Always thank them politely. And you can start answering point by point. If it was from the editors, you can do that. If it is from the reviewers, you can also take them up in similar manner. This example tells you that you have to, sometimes it is important to stick to your guns, okay? Because something has been suggested you don't want to do. Like in this example, omission of one figure was suggested, but the author said we don't want to do that, not only because we have the full permission to use it, but also we have put in a huge effort to redesign and interpret descriptive text, which we believe is crucial to understanding the concept of digital healthcare. If an important good suggestion has been made, always agree to that and effect a change in your manuscript. Re-revise, if you are asked to re-revise, you do the same with the smile, with a smile. I mean, there is no point sort of, being uppity about it. And if there is something, I mean, if you look at this remark, it could be very upsetting. To me, this looks like an unplanned, poorly designed study, a retrospective analysis of very few patients of, this disease. Politely, the authors say that we have designed a retrospectively appraisal. We have designed this study to retrospectively appraise the real life usage of particular drug. The number is substantial, whatever. Okay. It's just a sort of, factual and diplomatic, polite statement of why you had done this study. And that is actually enough. And our study definitely adds to the body of literature on this. So these comments automatically becomes well negated as desired. It is a scientific discussion which is happening, or a dialogue which is happening with the reviewers. So if you have points where you need to give them the reference, you can actually give them the reference. You can actually, in your response to the reviewers, you can have citations made. You can reference that, as you can see here. Okay. So after your revision or re-revision, there can be only few outcomes. If it is accepted, congratulate yourself. If it undergoes further round of reviews and revisions and then accepted, again, congratulations are in order. But it could be after a review, it can be rejected. So coming back to you for a review is not a guarantee for its ultimate acceptance. It could still be rejected because the editors deem that there is no point further revision, or it could be straight away rejected. If it is rejected, we have to sort of, we have to learn to how to face rejections, because culturally, we may not be sort of, aware of rejections are actually an integral part of our life. And there is no point feeling insulted. It is not about academic superiority. So as people falsely believe that if you have a friend in the editorial board, he or she can get your manuscript published. So wrong is the sort of, belief that it can lead to rejections if you have, perceived enemies in the editorial board. And as I said yesterday, rejection is not about you. It is actually about the quality of work you have submitted. It could have a poor methodology, okay, poorly written, scientific content is poor, language is poor, it is making tall claims and assertions, data is incomplete, data is hidden, scientific analysis, statistical analysis is inappropriate, there is suspected and then proven plagiarism, conflict of interest are cannot be overlooked. So there are several different reasons why your manuscript can be rejected. What we believe as authors that our work has got no faults. Okay, we think that my paper has no faults. Editors are actually generous. Okay, they, based on the reviewers' feedback and the global relevance of your paper, which has got with the globe on a global scale, actually your paper has got no relevance at all. And reviewers are also not that enthused. So editors are actually fairly generous, okay? But if you consider your own feeling about your own paper, this is how the global scale of things are. So it is important to consider this voluntary work by your editors and reviewers in the desired high regard. And whenever you are invited to contribute to the science in that way as a reviewer, please never say no unless it is on a subject where you have no expertise and you are genuinely short of time. So if you get rejected, if your manuscript gets rejected, it is best to shun negativity and move on, because negativity is not going to give you anything at all. You have more research to do, you have more case reports to write, and you got a busy clinical life and of course, commitment to your family, whatever. So you have several options after rejections. You can try without making any further changes in the manuscript to a different journal. Okay, you can try another journal after you have made revision based on whatever inputs you got from this particular journal. You can ask your non-author colleague. And here I would say it is best, if you, when it comes to manuscript, it is important to have an honest opinion. So if somebody is saying your manuscript is very, very good, no problems at all, I think you need to send it to somebody else. And this is called the local peer review. If there is if it is feasible at all to extend your study and it improves the sort of the numbers or the clarity in the message, you can do that. But sometimes you have to realize that it is best to give up on this manuscript because it has got fatal, non-curable flaws. And if you persist with this, you are going down and down, and you will be looking at inferior and more inferior journals where it will be published, but hardly anybody would take a notice of that. Rebuttal is another option available to you if the journal allows. Rebuttal is basically saying that there are, you are not that happy with the reject decision. And why? Because you believe that there are scientific merits in your paper, and there are few important issues which appears to have been overlooked by reviewers and editors. So you actually seek the editor's view on should your manuscript be not allowed to have another look by editors. Never say that you want to have another editor or another reviewers to look at the paper. That is an editorial discretion. Let them do what they have to do. But don't be emotional about it and don't claim your academic superiority. We get some rebuttal letters where authors say that I have published 100 papers in better journals such as yours, and was surprised to see this rejection. So that type of sort of superiority claim assertion is out of place here. But even after you have rebutted against the rejection, and outcome of such process could still be rejected. But as I said, you got several different options available to you if your manuscript is still rejected. Okay. If ultimately, if your manuscript is accepted, as I said, congratulate yourself and your team, and then look forward to your unedited manuscript being available online in many of the journals. And usually within 4 weeks, you'll be sent a proof of your manuscript, which you have to read very, very carefully and make necessary changes. And they will be small changes and return within specified time, which is typically 2 working days. And then in due course of time, you'll be happy to see that it's been published both in print or print alone or online or both. Okay. So coming back to the tips of effective writing or tips to get successfully published is basically what I have said yesterday. And again, I will refer to George Orwell's principle, and never use a long word where a short one will do. And when it is possible to edit out a word, always do, and use simple language, simple words, avoid jargon. So once you've chosen the right journal, conform to the journal's instructions and keep it simple. As I said in the previous slide, remember Orwell, a British journalist, highly acclaimed, but he completely turned around what used to be principles of effective writing before his time. Okay, and always avoid claims and assertion. Round it off, as Molly said yesterday. Use a diplomatic language to say the same thing, but don't come across as assertive. Here, assertion has got no rewards. And you would have realized by now that actually the entire workshop has been giving you tips. So we discussed title, abstract keywords, IMRAD format, references yesterday. And few of the other important things will be discussed later tonight. And always use a local peer reviewer before submitting, because this would help in weeding out overlooked mistakes and issues in your manuscript. And actually, it will make it more likely that your manuscript leads to a successful publication. So I think I'll end with that. Thank you very much.
So there are a few questions in the question answer box. How often the editor-in-chief overrules reviewer's decision?
Quite a few times. It is not automatic. Okay. So if let's say if there are 2 reviewers who give you a major revision decision, the editorial decision can be actually a reject. Okay. So no, it does not have to be like that. Editor often gets a second chance to read the manuscript again in view of reviewers' comments. So that is also, it's a two-way process. So no recommendations are binding. Only the editor-in-chief's decision is final, basically.
Thank you, sir.
Thank
And the
you.
next question is how to request the editor to publish the accepted manuscript to avoid the article becoming obsolete if delayed.
Okay, I don't think there is a recourse. I think you have to choose the journal wisely. You look at the time. You look at the timelines of the journal related to sort of its publication time, online availability, and all that. There is no recourse. There is usually a queue of first accepted, first published, and of course the editors are free to move the articles up. if there are something, if they get something, which has got more value to the scientific community at the current stage. But yeah, I mean, of course, you can make a request. I always say that make a request, polite request.
Thank you, sir.
Thank you. I think we move on now.
Yes, sir.
So I think we'll move to the practical part. And Mohit, you want to take over, please?
Yeah, I'll just start sharing the screen. And first, Samir, Dr. Samir, you can take over. Yeah. Is the screen visible?
Yes, it is.
Yes, sir. We
Thanks.
can. Yeah.
Okay.
Yeah, thanks, Mohit. Yeah. Yeah, good evening, everyone.
Samir, just 1 second. Mohit,
Yeah.
do you want to say how were the response yesterday? Just 1 or 2 sentences, please. How many responses you received yesterday?
Yes, we received over 150 responses
Wow, fantastic.
from the attendees yesterday, and quite a few of them have identified nearly 70 to 80% of the errors. Yes.
Okay, Samir, yeah.
Yeah. We'll start. Yeah. So if you remember my yesterday's lecture on the same topic, title, abstract, and keywords. So let's start with the title. I believe all of you have gone through the paper because that is extremely important before you start writing the title. It should effectively convey what your manuscript is trying to say. Now, look at this title. What is DMARD therapy is effective in chikungunya arthritis? Do you think this title is adequate? Yeah. So one of the things which I had mentioned yesterday was that the title should be small, concise, but at the same time, it should convey the whole manuscript. Now here, this title, what are the fallacies in that? Okay, there is an exclamatory mark, so you should avoid all such kind of things. It should be simple. DMARD therapy is effective in chikungunya arthritis. Now it does not mention what DMARD therapy you are talking about. There are multiple DMARDs are there. No? So whether it's a monotherapy, whether it's a combination therapy, in the paper, if you read, it is combination versus monotherapy. So that is not conveyed by this title. Plus, it does not mention what medication we are talking about, right? And it also does not mention how do you conduct this study. So if you look at the paper again, it was a 24-week randomized controlled trial. And again, chikungunya arthritis again is a big term. You know? So it could be acute, it could be chronic. So do you use the DMARD therapy for every chikungunya arthritis patient who comes to us, even during the acute phase? No. So the manuscript says that we are considering DMARD therapy only in patients who have chronic chikungunya arthritis. So that also this is not conveyed by this title. So we need to change the title. So it could have different things. So first we have to mention that we were using a combination therapy. So a combination DMARD therapy should be a part of this title. You have to mention that we are looking at chronic persistent chikungunya arthritis and not just simple chikungunya arthritis. So these two terms should be there: chronic combination DMARD therapy, chronic persistent chikungunya arthritis. It also should mention that it was we are trying to see the efficacy of monotherapy versus a combination therapy. So we should add the word efficacy. So it should be like efficacy of a combination DMARD therapy versus hydroxychloroquine monotherapy in chronic persistent chikungunya arthritis. If you remember what I had said about a SPICE title, so there are multiple components of this title in the form of what was the setting was there, what was the population it was used in, what was the content. So we have not mentioned how did we do this study. So what we had mentioned in our manuscript is a 24-week randomized controlled open label study. So all these things are very important for writing this title. So the correct title would be efficacy of combination DMARD therapy versus hydroxychloroquine monotherapy in chronic persistent chikungunya arthritis, a 24-week randomized controlled trial. Next, we move on to the abstract. Now, again, abstract, if you can remember, it should be very concise. It should be simple. It should be very, very crisp, and it should convey what your manuscript is trying to say. So let's start by reading the introduction of the abstract. Here, if you look the highlighted marks, like name chikungunya derives from the Kimakonde language, becoming autotted, and see, this is part of the introduction in the main text, but this should not be a part of the introduction in the abstract. So the highlighted part should not be a part of the abstract. What we need to write is, we need to be very careful. So we know that in a proportion of chikungunya arthritis patients, they might run into chronic persistent phase. So again, now you should remember that CA, not everyone knows what CA is. So whenever you are writing CA for the first time, you have to clearly mention, it mentions chikungunya arthritis, and into bracket you write CA. Henceforward, you can use the term CA, but whenever you are using it for the first time, you should write it completely. So here you would write, in a proportion of patients, chikungunya arthritis into bracket CA might run a chronic persistent course. Okay. The treatment for this phase is not very clear. Now we move on to the next part. The objective was study to evaluate the efficacy of DMARD combination in persistent CA in a group of patients with chronic CA, and to study the response at 3 and 6 months follow-up. But again, we have not mentioned that this is a randomized parallel open label study. We have not mentioned the duration. So we should ideally write that this is a randomized parallel control study of 24 weeks duration. And here we evaluated DMARD combination in patients with persistent chronic chikungunya arthritis. Now we move on to the methods part. Methods part, again, you say, right? So there were consecutive 139 patients with, again, chikungunya arthritis who were screened for eligibility to receive either combination DMARDs or monotherapy with methotrexate. Now, there's a big flaw in this. We are looking at combination DMARD, but we are looking at on monotherapy only with hydroxychloroquine, not with methotrexate. So whatever is written in the manuscript, it should be here in the abstract. So in the manuscript, we are trying to tell HCQS versus combination DMARDs, and here in the abstract, we are writing methotrexate is incorrect. So you should be careful of what words you are using. Now, this patient were, so here it should be monotherapy with hydroxychloroquine. This patient were randomized to receive either combination therapy with methotrexate, sulfasalazine, hydroxychloroquine, or to continue HCQS monotherapy. Right? So both groups received oral prednisone up to 6 weeks, right? And then you have the other parameters. But here again, one thing which is very important is that you need to mention that the consecutive 139 patients which were used, and when did we classify the patient at persistent chronic arthritis? So in our manuscript, we have written it for more than 1 year. And we also should mention which year which was. We have to mention that the epidemiological criteria for chikungunya crisis were fulfilled. And there, more importantly, we have said that patients who are on hydroxychloroquine already were then randomized. That also is missing in this method. So we should write, of this patient who were already taking hydroxychloroquine monotherapy and had active arthritis, were either put into fixed combination therapy or continue. And then both the groups were given oral prednisolone. Assessment was done at 4 weeks. And here again, this is very, again, quite, it's not written very clearly that other parameters were treated, disease activity. So we, in our studies, what we look at is basically, you look at the primary efficacy and you look at the secondary efficacy. So you should mention clearly that both the assessments were carried out for primary efficacy, which was the DAS28, the DAS ESR score, and the secondary efficacy, which was the HAC and the visual analog scores. So that we move on to the methods. Next, we go on to the results. In the results, again, first line is 74 patients were finally randomized, 37 to combination therapy and 35 to monotherapy. Now, if you add, the total of this is ideally 72, and here you have written 74. So it should be correct. So this thing should add. So whatever was in combination therapy and monotherapy, the total should be correct. Now, both groups were matched in well research, that is fine. But again, you have mentioned equal number of male and female patients. So you are mentioning there were equal number, and in the next line, you are still writing both groups were matched in all respects. So there is no need for you to write there are equal number of male and female patients. Again, the mean age and all is need not mention. You're going to mention them in the final result section. So by saying both groups were well matched in all respect is good enough. Now, next is at 24 weeks, the combination therapy. The combination therapy showed a significant improvement in both disease activity. That is correct. At the end of the study, the VAS was less significant, so that also is correct. After that, we move on to the conclusion part. The conclusion part here, so again, no, the conclusion part of statements are like the present study is the first randomized control study in the world. So you should not make such bold statements. You know, that is not required to prove the efficacy of DMARD therapy in chronic arthritis. And again, you know, based on our results, all patients which you cannot make some blanket statement should receive combination therapy irrespective of duration. What we are looking at is basically patients should be given combination therapy only in patients who have chronic persistent arthritis, not in self-limiting chikungunya arthritis patients. And so that is how you need to, so this the whole conclusion which you have written is not correct. What you should be writing that this study only proves that evidence that for chronic persistent chikungunya arthritis, combination DMARD therapy with methotrexate sulfasalazine is superior to monotherapy with SCQS. And that's it. One more important thing which you should always do when you write your abstract, whether it's a structured or it's an unstructured abstract, is you count the words. That's the first thing you are supposed to do. So if you count the number of words for this abstract which is there for discussion, there are more than 500. So before reading, it will be straight away rejected. So always count the number of words, and we have to keep it less than 250 at least. You know? Otherwise, it won't upload only. Finally, we come to the keywords. So keywords again, you know, viral arthritis, that is fine. Methotrexate is fine. Systemic sclerosis. I mean, we are not talking about systemic sclerosis. Muscular sclerosis is fine. Arbovirus is fine. So that is in brief. So again, this if you can make out, we are not using all the words which are mentioned in the title. We are keeping in different words. I think we move on to introduction. Thanks, Mohit.
Dr. Mali, could you please take over the discussing the introduction?
So in the introduction, this is very clear that there is too many words. Obviously, if you can you scroll down, Mohit? So it is taking more than 2 pages. Can you go up again? What happens is what is happening here is there's too much of history. That is number one. So there's too much history. There was no need at all to mention about the history of chikungunya. That is the first mistake here. Another second mistake is not to tell about the epidemiology so much in detail. Probably if chikungunya comes as epidemics, you could mention when the latest epidemic has occurred, but by and large, you need not mention so much. And again, introducing about the disease, you have to go straight to the point about chikungunya arthritis if you are submitting to a journal which deals with rheumatology. However, suppose you are submitting to an internal medicine journal, then maybe it would be worthwhile to say that the manifestation of chikungunya involves the joints and fever, and the arthritis can be acute or it could be progressing into chronic also. And out of these chronic arthritis patients, this is a subgroup of patients that we are interested in, and it is this group of people we are trying to study. That is one. And the second mistake here is that there is variation in the terminology of the chikungunya. Here we have chikungunya is abbreviated as CHIK, but if you look at down, again here it's mentioned as CHIKV. And then chikungunya arthritis again is abbreviated in a different form. Can you go down, Mohit? Can you scroll down, Mohit? Okay, can scroll down. Scroll down.
scroll down. So the first point, as I had already told you earlier yesterday, is to explain to introduce why the introduction is important, and then you have to present the lacunae in knowledge. And number 3 is you have to tell the aims and objectives and the underlying hypothesis. So probably here the hypothesis has been mentioned because the author has written that the therapy of chikungunya is not very clear. Many patients continue to receive HCQ without any evidence of same benefit. Yet such a study has never been done before in the treatment of chikungunya arthritis. Therefore, the aims and objectives of the study are 1, 2, and 3. But this is not the way to write the aims and objectives. You need not write in the thesis format. This has to come in one single line because you're submitting to the journal. So I think these are the major points in the introduction. Over to Dr. Sham.
Thank you, ma'am. Mohit, can you please go to the methods? Yeah, so coming to the methods, hope all of you must be remembering the checklist. So initially they have put it as the study was conducted in a prospective manner. Then again, it was put as prospective randomized study. So you can, so we should be very specific. The word like manner could have been avoided. So we can just put it as a prospective randomized. I think this was an open label study, or if you're going to do a control trial, you can mention it as a control trial. So it was conducted from the study duration has been mentioned. So only with regards to the study duration, what we could be more in clear and detail is, as I told, method should be very specific. So many of these patients were screened. Some of them are already on hydroxychloroquine and they were randomized and then started on triple therapy. So how many of them were screened? What was the duration at point or at which they were screened? How long was it screened? So you can actually use a flow chart. So patients were screened from a period of this and this or so many weeks. Then out of which how many were included in the study, like how many were excluded, like that you can mention it as a flow chart. So how long was the screening period, how long the time taken for randomization, all those things. Then again, suspected chikungunya or is it going to be confirmed chikungunya, that has to be mentioned in clearly. So taken history from the patient and also from the neighbors, maybe some might differ, but nothing wrong in adding that because we want to know whether at that time the endemic was going on in that particular area. So again, coming here, the medical records. So medical records of whom? Was it from the patients? Was it when they are visiting the hospital? And again, what exactly was the place from which all these patients are chosen is not mentioned. Was it the patients who are visiting the rheumatology OPD or the medicine OPD who came with arthritis, where they screen, where those patients old record screen, all those things are not mentioned clearly. Mohit, can you go a little bit down? Mohit? Thank you. So what has been mentioned clearly is who are the ones who have been going to be classified as having a history of chikungunya infection. So the serology has been mentioned. So in that, the RT-PCR has been highlighted. If possible, it could have been expanded, but sending it to a rheumatology or a standard medicine journal, we expect the readers to understand that RT-PCR means the abbreviation, many of them will be knowing it. It's a reverse transcriptase polymerase chain reaction. But if you want to be very clear, it's better you can expand it also. And suddenly you can see here, they mentioned it is interesting to note that there were more than 500 patients, which is totally not needed. And similarly, unfortunately, during the studies period, we are able to screen only 139 patients. Again, it's not needed. Similarly, here down, if you can see, although all patients had X-ray of the hands and feet, none of them had erosions. So this will come more like a result section. None of them had erosions. And again, going further, and they are discussing it. Absence of erosion is considered a good prognostic sign. This was only told in our discussion yesterday that many times unknowingly, without our knowledge, the other parts, other sections, contents creep into methods, or similarly for the other sections. Other thing which was not very clear in this, who are the persons whom they consider to have a this one, what you call arthritis, and how they were included. Like, so Mohit, can you go further down? So whenever we discuss the methods, it has to be, the population has to be defined from where the study was done, has to be clear. Then what was the intervention done? So the intervention done, persistent arthritis has been mentioned. But what has not been mentioned clearly is what exactly was the outcome measure. So whether it was only DAS28 or only CDI. So usually this type of statement won't be acceptable. When ESR or CRP was unavailable, we did disease activity calculation using the CDI. So prior to that, because this was a prospective study, so we should define whether we are going to assess by either CDI or DAS28. And similarly, the response, Euler response, again, we have to, if it is a rheumatology journal, okay, it could have been cited, but still the outcome measure, you can tell which is good response, which is moderate response, so that the readers are very clear about it. Similarly, a few patients also had their quality of life assessment done. Again, why only few patients and not everybody? That is not the way it should be. Then coming down further, arrangements to administer injectable what do you call methotrexate subcutaneously once a week was to be made for those reporting intolerance to oral methotrexate. That's fine. So again, whether as mentioned in the study protocol, all of them are treated for 24 weeks. This is fine. The other thing which is missing here is you can see is two things. One is ethical clearance and another is informed consent. There is no mention of that. So coming down further, things, okay, somebody has highlighted the ethics statement is missing. So statistical analysis, good thing, as we spoke yesterday, they have included the sample size thing, and also the power, like whether the study was adequately powered or not. Those things have been included. Again, they have not mentioned whether it was normally distributed, whether it was a parametric or non-parametric, but still they have mentioned the particular statistical test which are supposed to be used. So the statistical part is okay. The ethics statement and informed consent definitely is very important. And overall, above, what I was trying to tell is where they were screened, to just sum up the population, how they were screened, what was the duration over which they are screened, and then what was the exact outcome measure. All those things have not been mentioned clearly. So all those things should have been mentioned clearly in this. Thank you. Maybe next I'll call Mohit to take over.
Yeah. So I'll just move on to the mistakes in the results section. So as you can see, the first error here, it is written about 500 patients were screened. So we do not write the approximate numbers. We need to be very specific. Similarly, in the next sentence, you say about 1/3 of these were positive, about 1/3 had IgG antibodies. So one error is that they are writing the approximate number and not the exact number. And plus, this sentence, as you can see, appears verbose. It could have been cut down to at least half the number of words. Another error here is, as you can see mentioned here, figure 1. And when you go to the figures and tables at the bottom of this manuscript, figure 1 is missing. It is not there. Now, when you come to here, the mean age in the combination group was this and the monotherapy group was this. There are no qualifiers. What do you mean by this? Whether age in years, months, what is this? You need to have the qualifiers here. Then again, in this sentence here, RA factor was present in 2% versus 3%, combination versus monotherapy. So this could have been written better in fewer words. Then, as Dr. Sham said in the method section, so plain X-rays were done. That has to be mentioned in methods, and whether there were erosions or not has to be mentioned in the results. So you need to be very specific. Then the next line we see, we found that 19%. So this is not the correct way. Either you write 19%, or when you are the number is in single digits and you need to write say 5%, you write 5 FIVE and then then spell percent. Then you come down here. Next, I'll just scroll down. See here, the authors write, this suggests that in every patient with early arthritis, viral infection should be ruled out, or it is possible that chikungunya fever has triggered RA in these genetically predisposed patients. So this is an interpretation. This is not a result. This should not come in this section, and this should be further elaborated upon or spoken about in the discussion section. We'll see the tables and the figures at the bottom. Again, here, as you can see, on the whole, many patients were on 200 milligram per day of hydroxychloroquine. So not many patients. You have to be specific how many patients were on hydroxychloroquine. And then the next here at the bottom, you can see quite highly significant improvement. You need to say whether it was statistically significant or not. Quite highly significant is inappropriate. And then we'll go to the figures and tables, as I see here, highly significant. just say whether it is statistically significant or not. Then you look at this sentence here, the use of NSAIDs and paracetamol as group, data not shown. Why has this data not been shown, and why it is written here that the data has not been shown? This needs a better explanation. I'll just move down to the tables and figures. See, there are several mistakes in this table. You can see the stub is not there. And then the number of people in the combination group and the monotherapy group has not been given here. We move on to the next table, and you can again see the stub here is missing. And later on, Dr. Kirti will tell you about the link to the original article. Please go to that original article and you will see what differences are there in that and this dummy manuscript. And when you come to this figure, the very important error that you can point out is that figure 2, it is labeled above the figure. We had discussed yesterday that the tables are labeled above and the figures should be labeled below. And another error that I missed out in the previous table, we have used several abbreviations here, the SJC, TJC, and LDA, and COMB for combination, mono for monotherapy, and they have not been expanded at the bottom in the footnotes. So this was about the results section. What I'll just give you the answer to the quizzes that we had yesterday. Can anybody tell me? I have changed this tab. Is this visible? Is the yesterday's quiz visible to everybody? Fine. I'll assume that it
I
is
can see.
visible.
I
Okay,
can
fine.
see it. Yeah.
Fine. Fine. So what type of data are these? We had seen quantitative and non-quantitative data. So of course, age, weight, height are quantitative. Whether they are continuous or non-continuous, they are of course continuous, because when we see height, it can be it can be 2 meters, it can be 1.7 meters, and it could be 1 meters, 70 centimeters, and 7 millimeter also. This is a continuous data. Then married, yes or no, male or female, this is a non-quantitative data, and whether male comes first or females come first is an eternal question, so they cannot be put in an order. So this is a nominal data. The next one, underweight, normal, overweight, and obese. These are again non-quantitative data, but they can be put in a particular order. You have underweight, then normal, then overweight, and obese, so it is an ordinal data. Then tender and swollen joint count, these are quantitative data, but these are non-continuous. Then you can see this next quiz that the table we saw yesterday. So what all things were missing in this table? In this table, you did not have the stub here. Then what are these less than 30 to 50? If it is age in years, it has to be marked here. Then again, there is no units for ESR and CRP written here. Then what are these values? We have to specifically write that this is mean plus minus standard deviation. So these are the answer to the yesterday's quizzes. And now I would like to invite Dr. Durga Mishra to please discuss the discussion.
Good evening. So now we go to the discussion. Dr. Mohit, can we go to the first paragraph? Yeah. So if we see the first paragraph, the paragraph details what chikungunya viral infection is and does not really discuss the key findings of this particular study. If you remember, we had discussed yesterday, the first paragraph of the discussion should summarize what were the key findings of this particular study. This looks like more a literature review, and this has more of a place in an introduction rather than a discussion. That too, it is quite elaborate. It has talked about chikungunya viral infection and epidemiology. It could, even if it was a part of the introduction, it could be truncated somewhat. So that is the first flaw of the discussion. And this paragraph was probably introduced to drive the fact that the first paragraph should actually be a summary of the key findings, as the second paragraph in this manuscript is. So if we can move slightly down, Dr. Mohit. Yeah, so thank you. So in the second paragraph, the authors have tried to summarize their findings. However, there are certain issues here. First, if you remember, we had discussed about placing things appropriately. Results should not come in the discussion. The discussion, when it describes the study results, it should describe them in a very succinct, brief manner. But here, a lot of results with their values are mentioned, probably repeated from the results section. So that's not a appropriate thing to do. All these highlighted areas, this particular sentence, the last but one sentence, all of these would be better placed in the results rather than in the discussion. The next issue with this paragraph is, if you read the authors say, in the study we conclusively proved. How could they conclusively prove it? This was just a single study. What was very interesting, the next highlighted red statement, what was very interesting was that DMARD therapy also had an effect on reduction of disability and pain effectively. Hence, from the results of our study, we wish to recommend DMARD therapy for chikungunya arthritis. How could they recommend based on a single study? So these are typical examples of overstatements. These are overstatements that one should avoid in the discussion. Try to put things in context. We found this appears promising, requires further studies, and if further studies confirm our findings, then it may be recommended. So that would be a better way of placing it. The next couple of paragraphs are actually quite well written. They have discussed the findings of the study in the context of the available literature. So they have compared it with previous studies in the third paragraph. In the fourth paragraph, they have looked at some pathogenetic mechanisms in chronic persistent chikungunya arthritis and attempted to explain their study findings in the context of those mechanisms. So these are actually quite reasonably well written parts. Then if we go to the next paragraph, the fifth paragraph, again, they have justified the dose that they have used. So that is a pretty well written portion of the discussion. If we can go down a little bit further. Here again, in the sixth paragraph, the authors have referred to a figure 1. That's all right. You could refer back to figures. You could even have a table or a figure available in the discussion, say a table summarizing results from similar other studies. So provided you are not extensively repeating the results. Again, here they have repeated a lot of things about the results, screened this many patients, and a lot of these things could have found their way better in the results. So that's not really necessary. One needs to give a concise summary. Then in the next paragraph, they have mentioned the strengths of the study was that it was randomized, had many participants with few dropouts. That's quite a non-specific statement. It doesn't mean anything. What do you mean by many? What do you mean by few? You could say that had less than 20% dropouts, which was a reasonable amount of patients were continued on follow-up. So again, try to avoid non-specific statements. Try to make statements that are specific, succinct, and put the message clearly in as few words as possible. Now, if you see the very last couple of sentences, the present study is the first randomized controlled study in the world to prove the efficacy of DMARD therapy in chronic persistent chikungunya arthritis, and the authors urge that all patients with chikungunya arthritis should receive DMARDs irrespective of duration of illness, and also urge the government and authorities to take steps to control mosquito-borne illness more urgently and effectively. First, can the authors be really sure that this is the first randomized controlled study? This is not a very good way of putting it. A better way of putting it would have been, to the best of our knowledge, this is the first randomized controlled study in the world to assess this aspect. Then, based on a single study, to make recommendations that all patients should be treated irrespective of duration of illness. Was your study designed to assess whether all patients should be treated irrespective of duration? It wasn't. It was designed to check or compare two different regimens. So again, you're drawing conclusions not necessarily based on your study findings. And the final portion of the statement, urging the government and authorities to control mosquito-borne illness. This recommendation is not at all based on this study and is not relevant to this particular study. So I do not find any reason to write this kind of a statement. At the best, the authors could have stated that, to the best of our knowledge, this was the first study. This shows promise for combination DMARDs for the treatment of chronic persistent chikungunya arthritis, requires confirmation by further studies. That would be a better way of putting it, rather than making a lot of overstatements which neither reviewers nor editors and of course readers do not like. So these were all the points that I could identify in the discussion. I would like to give the mic to Dr. Kirti now for discussing the references. Thank you.
Thank you, Durga. So let us talk about the references. I'm sure all of you all must have gone through the manuscript that was given. So in the first place, what do you think is the referencing style of this particular manuscript? You all can type in the chat box. Okay, so So to look at, it seems as though it is Vancouver, but it is not a Vancouver format. It is not the ICMG format, because in Vancouver, after the author list, you have the title. After the title, you have the journal name, and then you have the year. But if you see here, in most of the references here, the year is coming in parenthesis immediately after the author's name, followed by the title, then followed by the journal name, the volume, and then the page numbers. So this is a modified version of Vancouver, where the journal has adopted its own style, where the references are listed in the order as they are cited in the text. So the number 1 citation is the number 1 reference here. So the number is the same, but the way in which the reference is written is specific for this particular journal. So it becomes very important for any one of us to actually look at the journal instruction, the author instructions that have been prescribed by the journal before we write up the references. Okay. So the first thing is that this is from the Clinical Rheumatology Journal. And according to this journal, this is the way a reference has to be actually written in this particular. This is the format in which the reference has to be written. Now, coming to the first one, obviously the first one is the typical Vancouver ICMG format, and it does not conform to the journal's format of writing a reference, and hence this is the wrong way of writing up the reference. It is not compliant with the journal's guidelines for writing up the reference. Coming to the second one, definitely here the author has picked up all the author names from the author list and has put it up in the reference, because you can see that 1, 2, whatever is there, these are the affiliations of the authors, probably the affiliations of the authors which are showing up here. And there are so many authors. Look at the number of authors that they have listed: 1, 2, 3, 4, 5, 6, 7, more than 8. So ideally, after 6 authors, they should have put an et al. Here. So that is the other mistake in reference number 2. And if you look at the third thing that has been highlighted, Tropical Medicine Volume 2012, Article ID 6391786, 6 pages. This is not what the journal has actually asked for. You have to write the name of the journal according to the NLM catalog, number 1. The year according to the journal's guidelines should have been immediately after the author's name. Article ID or the PM ID is definitely not required here. The number of pages which the article is not required. And the DOI has been mentioned only for certain references. So that is also not required. Now, coming to the 5th reference here. In the 5th reference, they have mentioned about paragraph 1 and line 3, which is not required. If you see, the reference was perfect until 1449250. That's it. So you have the author's name, the year in parenthesis, the title of the manuscript, the journal name, volume, followed by the page numbers. Paragraph 1, line 3 was unnecessary here. Going to reference number 10. Now here everything seems fine, but arthritis and rheumatology is not the name of the journal as per the NLM catalog. As per the NLM catalog, it is arthritis and rheumatol, RHEUMATOL. That is it. So you have to comply with the NLM catalog of journal abbreviations when you place a journal's name in the reference. Then going to reference number 15, which is the next highlighted one here. Now this, if you actually look at the original article, there are only 6 authors for this particular article, but and all the 6 authors could have been listed here. But what has happened here is that only 3 authors have been listed and et al. Has been added after that. So when the number of authors are less than or equal to 6, you have to mention all of them followed by, and if there are more than 6, then only the word et al. Has to be added after 6 authors. Next one is in the reference number 24. So if we look at this reference, like now first, the BMJ is not the abbreviation for BMJ, it is BMJ as per the NLM catalog. Volume number followed by the volume number, what you actually require is a colon and not a comma, following which H1046 comes up. Here again, the authors have mentioned the DOI as the entire website URL, which is not required. Now, actually, if you look at the journal's guidelines, they have mentioned that wherever DOI is possible, it has to be inserted. But it could have been a uniform thing where it could have been inserted for all the references, or should have been omitted for all the references. Coming to 27. Now here, this is not an NLM type of referencing style. Only in an NLM type of referencing style do we have PM IDs. So the PubMed IDs need not be included here. And coming to the last one, that is 30. Here the authors have placed the site URL directly. Now, when you type this website URL in the web browser, you'll find the original article, which is chloroquine phosphate treatment of chronic chikungunya arthritis, which an open pilot study. So ideally, that study should have been quoted in the reference format that is given here. Now, having said this, have you all found any other mistakes in the references that have been given to you all? So there's one more thing that we have not highlighted specifically. Reference number 3. Reference number 3, where if you've looked at this, I've just skipped this. Here again, arthritis and rheumatism is not according to the NLM catalog of journal abbreviations. So these are the mistakes that have been highlighted that are there in this particular reference section.
Great.
Then now Dr. Mohit would be posting the original article in the chat box. You all can have a look at it. And if there are any mistakes that each one of you all have identified, please let us know, because we could have missed something.
Yeah, I think this was very, very good from everybody. In the figure, I think one of the axis was missing. The x-axis was missing. You know, the okay. Yes. So that was that. And so Mohit tells me that 150 candidates from yesterday responded through the email, and between them they could figure out 80% of the mistakes in this manuscript. So I would like to congratulate everybody, because you have proven yourself to be an extremely good reviewer of this particular manuscript. So this is what happens. So you submit a manuscript like this, and keen delegates of this workshop would be acting as reviewers or editors. They will go through the manuscript in great detail. They will pick up problems, issues, they will seek clarifications, and based on whatever they have found, they will make a recommendation of major revision, minor revision, straight away reject, or accept to the editor. So I think, I would ask people to put in the chat box, because we'll be moving to the next talk, that what is your final verdict regarding this dummy manuscript? Accept, reject, major revision, or minor revision? And also, there is one option available, whether you are willing to review a revised version. Sometimes peer reviewers say that no, they don't want to because it's a wastage of time. So all the options are open to you. And I think we can move on to the next session, unless there are comments from my colleagues and Saxena sir and Rajiva sir.
Dr. Durga, I would just like to take this question that has been put in the chat box regarding the table in the discussions. If you want, I can read it for you. And Dr. Durga, you are muted.
Yeah, I didn't realize that was a question.
If we put up a table with comparison.
There are no such things as result tables or figures or tables or figures allotted for any particular section. The tables and figures are all for the manuscript. So you could, yesterday, I think an example was shown of, I think Dr. Sham had shown a figure that was there in the methods for a trial on rituximab, wherein the trial design was depicted using a figure. So the tables and figures can be there anywhere in the manuscript. It's just necessary to place it properly. A results table should not find its place in the discussion, and a discussion table should not be placed elsewhere. So I hope that clarifies the doubt.
Anything else, or we move on to the next one? Anyway, almost I'm counting these responses, and I shall be able to tell at the end what was the final sort of verdict, in a democratic way. So Aparna ma'am, please move on to the next session, please. Thank you.
Moving on to the next session, we welcome Dr. Rajiv Gupta for his talk on publication ethics and authorship. Dr. Rajiv Gupta.
Good evening. Good evening, friends, and good evening, Vinod. Nice seeing you after a long time. So today I've been assigned a topic which is a rather complex topic of authorship and ethics. So can I start my screen share? Yeah.
Sir, just put it in a slideshow mode. So
Yeah.
Yes, perfect.
So just beginning from the beginning, actually, it is very important for us to realize that authorship is a very complex process. And this process is very important to realize for everyone, because all of medical scientists, all of doctors, they all want to write articles. They want to write original articles, review articles, and whatnot. So I think that's why it is very important for all of us to realize that when we begin to write an article, it's a very complex process. Now we all know that we have been told that these are the various things that we need to write down: title, abstracts, conclusion, introduction. There's the sequence, and then you can make it up and down. But what I'm going to tell you is that you should even begin from the beginning when you are an author of the article. The responsibility of the author is to think through the whole process. First, number one. Number two, he should be well aware of the review of the literature which has been pre-existing, and he should keep everything in his mind. But I think the more important thing beyond that is the study question or the research question. Most of the times when I review articles for some journals, I always look at the research question and the aims and the objectives. Now, these should be the first thing which an author should be doing. And as an author, you should be responsible for the research question, and ultimately what you are trying to answer is the whole article. One of my good friends, Salim Yusuf, is in Canada, and he tells me that authorship is like story writing. You always make a plot, you always make uh, well, a broad outline, and you have to go according to that outline. In medical articles, all these outlines are very well defined in the IMRAD protocol. So I think need not think of that. But even then, you need to make a story of your research. And if you make a good story, it is acceptable. If you make a bad story, it is not acceptable. So the principal author has the responsibility to create the story. And that story is basically one question and one answer. Now the question is the research question that we set out to answer. And the whole article is based on the answering that research question. And what I do normally is to look at the tables and the data first of all. So I think the first step in the authorship should be figures and tables. That means you need to summarize your data in your figures and tables. That is the first step. And the second step possibly is to write an abstract. Now, when you're writing an abstract, you don't normally think of other person's work, other people's work. You tend to focus on your own work. And I think that makes it simple because you have a background statement that is of questions or answers. Then you have the method section, 2 or 3 lines. You have the result section where you summarize your tables. And then you have the conclusion section. So I think so that's I mean, so I just told you all this because I want to be sure that people who are listening to it, they realize the responsibility of being an author. Everyone wants to be an author. There are authors and non-ghost authors and real and fake and whatever you have. But I think that's very important for us to realize because ultimately an author should take the responsibility of the whole content of the article. And as an individual contributor, if you are 6 authors or 2 authors or 10 authors, you should be responsible for the whole article. That means you are responsible for the objective, you are responsible for the data, you are responsible to create methods, you are responsible for discussion and conclusions and reference and everything. So that responsibility is very important. There could be multiple policies which are regarding the authorship. Now, this is just an example from the International Committee of Medical Journal Editors, which is the Vancouver group, and they have mentioned 3 clear criteria. Actually, they have mentioned 4 criteria. Number one is there should be a substantial contribution to conception and design. Now, this is very important to realize. Consumption means production of the art of the study or of the research paper. So I think conception is conceiving. So there'll be 1 or 2 people who will be thinking through the whole process, who will be uh, trying to formulate a research question. So there's the conception. So the conception means the research question. So a person who has developed the research question can become an author. So that's number one. Conception is important. So a person has to be seriously involved in developing the research question, 1 question, 2 questions, whatever it is. But I think that's very important. So it is not essential that all the authors who are part of the article are part of it, but they should be involved in it. And in the very early phases of the study, they should have evaluated the question. And it is a group discussion. If there are 5 authors to be, you plan to have 5 authors or 10 or 15 or whatever you have, I think they all of should be contributing to the conception and design of the study. The second component is the acquisition of data. And I think again, a very complex question comes in, because acquisition of data is again a very difficult area to answer. There will be, I think, most of us, the studies, most of us who do studies like this, 1 or 2 people acquire the data. They could be a postgraduate student, they could be a junior faculty, or they could be a senior faculty. And now in the current scenario, health workers or research associates or research workers or PhD students or MPhil students, whatever you have, they are all involved in acquisition of data. For simple filling in the forms, like you go to a survey or you're doing some research, you're just filling in the form, is not is not enough to become an author. There should be formulation, so they should be help a person who creates the data acquisition platform, a paper-based report form or a computer-based report form. So people who create the platform, then they acquire the data. They should all be part of the. They could be an author. They may not be. I mean, depending on the number of the people who are part of the authorship. But simple acquisition of the data is not enough to qualify as an author. The third component is the data analysis. Data analysis will mean tabulation. Now, tabulation typically is done by a statistics person, but then as an author, you should be able to tell him what are the columns, what are the rows, how many tables, how many diagrams. So all these things are responsibility of an author. So as an author, it's very important that whatever you are doing, you have to have a catch or hold on the data analysis. So data analysis is a very important part of any article. So as an author, you should be responsible for data analysis, and then data interpretation. You have collected lots of data, thousands of variables or even millions of variables. And with the current computer technology, data analysis has become easy. But interpretation is very tough. When many times I find is an article used database have been collected and they have done all sorts of statistics. Now that's not the right way of doing research. You have to be focused that what type of research you want, how do you want the interpretation of the data, and remember the study question is the most important. So you have to be very aware that what was the research question and focus on the answering that research question. And that's the way you interpret the data. And if you are helping in data interpretation, you are qualified to become an author. So the guidelines, the Vancouver group clearly mentions that a person who has substantially contributed. Now, what is substantial? It may be a small advice, one day or 1 hour in a period of a few hours, you create the question, and many senior authors, many senior research workers, they especially contribute to create the study question or conception of the article. So they could be an author. So everyone who has substantially contributed to conception and design or data acquisition or data analysis and interpretation could be an author. Number 2 is drafting the article. Now, this I think is the most important component which we lack in India, in our country, and most of us fail to draft a very reasonable quality article. I mean, thousands and thousands of articles are written from our country. Although English is not the primary language, but all of us have studied medical science in English. So we know how to write an article, but essay writing or precis writing is an art, and we need to learn it. We may have to go to English teacher or primary classes to plan an essay. So drafting the article is very important. And as I've already told you, that drafting the article begins from the data analysis or writing the tables. You first of all you draft the tables, then you think of the research question, that is the background statement, that is the introduction. Methods is simple. You write what you have done. But then again, to write it in good English is very important. So drafting the article, drafting the method section, drafting the result section again is very important. So I think person who has drafted the first draft normally is the senior or the first author. The senior person is not like this that if I am the other department or a particular department, my name is number one. No, that's not the way. The first author is normally who has designed the study, acquired the data, performed data interpretation, and written the first draft. So a person who writes the first draft, which is the most difficult job to do, should be typically a first or second author. So I think that's very important. So drafting the article is important. Revise it critically for important intellectual content. Most of us who are authors in multi-centric, multi-site research, including me. Actually, I also do lots of multi-site research. For example, we have a study known as PEER, Prospective Urban Rural Epidemiological Study, going on for the last 20 years now. Lots of articles, I think more than 100 articles have been published from that study, New England Journal, Lancet, BMJ, everywhere. So what we do is that we create a research group. Our senior person, Dr. Yusuf, and the steering committee members, they decide that who will write the draft. And then we identify one young faculty, assistant professor, associate professor level. He writes the first draft. He leads the article. So he is the first author. So first author is not me or Dr. Yusuf. First author is the person who is writing the first draft. And of course, he has contributed into data collection, the data interpretation. He plans what tables, what analysis to be done. So I think that's very important. So drafting is important, and who is the first author is also important. I think, simple way is that a person who writes the first draft of the article should be the first author or the second author. Senior authors or senior researchers or person who has designed normally is the last author. So in medical articles, I think that's the sequence. First author and the last author is the senior person who has given important intellectual contributions. And every other author who is the co-author of the article has done something on design, something on conception, something on data acquisition, something on data analysis, something on data interpretation. And of course, they also have to review the article for intellectual contribution. The third criteria is that every author who is listed in the authors list has to give approval to the final full version which has to be published. All the multi-site articles, all the multi-centric articles, including articles from the global burden of disease, thousands of people as authors. Only yesterday we had a paper in the Lancet from the non-communicable disease collaboration, almost 1,200 authors because the database was about some million participants on hypertension. Again, but all of us received the final version. And some of us who did not agree to the final version could withdraw from the article authorship. So I think it's both way in and out. If you agree with the author conclusions, you are into it, but you have to say that I agree. If you don't agree with it, you can be out. You can opt out of the article. So again, but an author is a person who has to agree with whatever is written. Lots of articles which are politically sensitive, which are legally sensitive, which may be ethically sensitive. There could be some political issues, there should be some cultural issues, there could be some social issues which you did not agree. And if you don't agree with some of the versions of the article, you can always opt out. But then if you are an author, you have to accept that everything is there. And the fourth is most important, is that the author should fulfill all these three conditions mentioned above. So he has to contribute to the article, he has to draft or revise the article, and he has to give the approval. All these three things have to be there. So all these four things, there is no exception. If you have contributed substantially, if you agree to the contents of the article, your revisions of the article, all of them, you have to agree to that, and then you can be an author of the article. So I think that's very important to realize. So all authors have to agree to be part of the, and only then you are an author. It has got stuck. Then there are certain orders and abuses, which again I think is important to realize. The first author is one who conducts, we just talked about it, who conducts or supervises the data generation and analysis, and uh, and the proper presentation and interpretation of the results. So this is the criteria to be the first author. A person who has conducts the study could be first author, who supervises the data generation and analysis and proper presentation and interpretation. So that means a person who is making the first draft using the statistical tables, the statistical design, the table paper design, it is the first author. He puts the paper together and then submits the paper to the journal. Again, a very difficult area, and I think you will learn that how to submit the article as the time goes by. There could be first author and the corresponding author could be the same. But in a medical college, in a medical institution scenario, where you always like to encourage the young faculty and the young researchers, many of us like to not become the first author, but some of us may agree to become a corresponding author. So either the first author is the corresponding author, because I think there's a very important role to play, or the senior author should be corresponding author. And normally, I think when the young author is a student or a postdoc or an MD postgraduate, or he may move to another institution, somebody from the same institution will be like to be a corresponding author. So I think so. This is a very although it's a very important important area to to be a corresponding author, a first author. But I think it depends on the local institutional policies and the local milieu from which the uh, paper is coming out. Then there are ghost authors. Ghost authors are the ones who wrote the article, who participated in the research, but they are not there in the article itself. So they are known as ghost authors. Many times what you find is if the postgraduate student has gone from the institute, you don't mention his name. So he becomes a ghost author. So this is leaving out authors who should be included. But then the most prevalent problem all over the world, not only in India, is gift authorship, which I personally discourage, but I think in many situations could be inevitable. Personally, I will like that every author should be providing comments on a particular article. If he wants to be listed as an article as an author, there is no gift authorship. There's nothing is free. So I think that's very important. But many times what we find is that senior people in the same department or in the same college, same university, they tend to come up in the authorship. But I think a very important part of component of the whole issue is that now these Vancouver guidelines, they want that everybody who is listed as author should take responsibility for the data. And the data integrity, plagiarism, wrong presentation of data or mispresentation of the data or data fudging is becoming a major problem. Every day there are some articles which are retracted. And I think gift authorship, people who receive the gift authorship should also be very careful that they do not receive the gift authorship, because they have to stand with the article content. And I know that people in the US and Europe, where research is taken very seriously, people have lost their jobs if they have included their name as a gift author. So I think it's very serious business, and gift authorship should not be encouraged either from the person who is writing the article or from the heads of department or the heads of the institutions, who should not seek gift authorship. So I think that's very important. And finally, what you have is the acknowledged individuals. We need to recognize people who have helped in the research, but do not qualify as authors. That's very important. There are lots of other people. There are people, advisors, financial supporters, proofreaders, typists, suppliers, everyone. They are individuals who have assisted in your study.
A request to Dr. Rajiv, can you
Yeah, this is the last one. This is the last one. Yeah.
Thank you, sir.
So this is the last slide. So these are, I think, is very important. Advisors are typically like in the Angel Council, ICMR, where we go, we review lots of projects. We advise people that what is right and what is wrong. And in that case, we tend to not be included as an author. And finally, publication ethics. And I think ethics is a very big issue in medical publication. We need to define ethics. Every one of us should know what are the right way of doing things, what are not the right way of doing things. But then there are socio-cultural issues which are important. And then there are legal issues. Socio-cultural are real because I think we need to think, we live in a social milieu. We try to jumpstart some people so that we are ahead in the queue, but that's not the way publications are done. And then, of course, the legal issues, I already told you about the ghost authors and the gift authorship and all those things. So there are real legal problems. And if an article is retracted, if you are blacklisted, the whole group becomes blacklisted. So I think there's a legal issue and people can lose jobs because of this. So it's a very serious business being an author of the article. And I've told you what are the criteria which are determined by the international collaboration for the medical journal editors. So I think that's very important to realize. Thank you very much, and I shall be happy on any questions. Thank you.
Thank you, sir. If there are no questions, can we proceed to the next topic, sir? There is a question, can authors who are excluded complain to editor for withdrawal of article on ethical grounds?
A difficult question to answer. I think that's not the way things work. If you are qualified to be an author, the first step is to talk to the local authorities. And if your application goes to the local authorities instead of directly to the editor of the journal, editor will not know who you are. So every Tom, Dick, and Harry can always complain to a person. So that's not the way it works. It works only through a process of the institution, and that institution has to be in the loop. Only then you can make the complaint.
Thank you, sir. The message well taken. Thank you for your presentation, sir. Now, moving on to our next presentation, I invite Dr. J.N. Saxena to present his talk on plagiarism and how to prevent it.
Thank you, Dr. Aparna. I think it's been a great evening so far, and it's amazing that even at the end of the session, or almost at the end, we still have a large number of participants who are willing to listen to us. So the credit goes to the topics and the way it has been chosen. Well, I am now going to talk about plagiarism, something that affects all of us. And so this evening I'll be talking on plagiarism, something that affects all of us. And because it's so rampant and it's not just a recent phenomena, it's been around with us for ages. And when I come to the etymology of the word, you'll realize that the problem of plagiarism has existed almost for the last 2000 years. But then when earlier it was so difficult to detect plagiarism unless the editor was aware of the entire literature in that field, or the original author would complain to the editor that my work has been plagiarized. But with the modern publishing, with the availability of computers and the availability of the net, detecting plagiarism is a very easy task. So we have to be alert as to what we are doing, how to avoid it, how to prevent it, and what are the types. So I think my first slide is kidnapping and how to avoid it. Now you may be amazed that I'm talking of kidnapping. I'm not a policeman and I'm not a chowkidar. So how come the word kidnapping and how to avoid it has come around? Well, we have had a very heavy session all through, so I thought I would start off with kidnapping, prevention of kidnapping and avoidance of kidnapping. And why do I say that? Well, interestingly, the origin of the word comes from the Greek word plagion, taken up by the Latin people, plagium. Then a plagium means a kidnapping, a plagiarus is a kidnapper. And in English, in the early 17th century, the word plagiarism came into use, which meant taking something from some other person. So that is the origin of the word. And now I'll change to the next slide, and you let me know what you may be observing. There is something missing in this slide, and that is now from this slide. This is the origin of the word. The slide that I've taken is from the definitions from Oxford Languages, from the Google search for plagiarism etymology. Now that is a clue as to what I'm going to talk about. If I were to go back to that slide, this by itself would have been sufficient to tell what I'm talking about. But if I did not mention the source, I would be committing the sin of plagiarism. So this is the way we'll be moving ahead. That we must quote everything from where it has come. And especially when I'm talking of a topic, plagiarism, where there can be nothing original or new, even then I have to mention where I've taken these things from, where have they come from, and what relevance do they have for us. Now I'll give you an example. The increased thyroid nodule size impacts cancer risk in a non-linear fashion. A threshold is detected at 2 centimeters, beyond which the cancer risk is unchanged. Now this would have been sufficient. Now, the threshold of 2 centimeters, beyond which the cancer risk is unchanged. Now, this would be sufficient by itself, but is it? This idea did not come from my research. I did not observe this. I used someone else's knowledge or observation about this fact. Alternatively, what should have been done? According to Kamran et al., then you have a 1, increasing thyroid nodule size impacts cancer risk in a non-linear fashion. A threshold is detected at 2 centimeters, beyond which the cancer risk is unchanged. Or we could say increasing thyroid nodule size impacts cancer risk in a non-linear fashion. A threshold is detected at 2 centimeters, beyond which the cancer risk is unchanged. Then we have the entire sequence. The Thyroid Nodule Size and Prediction of Cancer, published in the Journal of Clinical Endocrinology and Metabolism, volume 98, issue 2, February 2013, page number this and this. This is the way everything that we present in our research paper should be mentioned. Now, if you notice that we are not just talking about what has been said, but who said it, when it was written, and if possible, when was it last accessed. Let's take another example, something that we are all familiar with. What's in a name? That which we call a rose by any other name would still smell as sweet. Now, if I were to present this in a way, whatever you may call a barfi, it will taste just as nice. Very clearly, I am not Shakespeare. So I should say, as Shakespeare has said, what's in a name? That which we call a rose by any other name would smell as sweet. Now, this is an idea that has been stolen from Shakespeare, because if I say a barfi will smell, taste as sweet, it's just changing the words. From the rose it comes to barfi, and from smell it goes to a taste. Now, stealing words is plagiarism, as is the stealing of ideas. Now, that is very important. Stealing of ideas is one of the major things of plagiarism in our society. I'll give you a couple of examples. Sometimes you go to a conference or you see something being presented over there, you pick up that idea, come back, start a middling research or some basic research on that, and present it as your own work. So you have stolen somebody else's idea. Or something which is even more gruesome is that when a paper has been submitted to a research peer review or to some doctors or to your seniors, they will pick up that idea and work on it and present it as their own. But this is a stealing of an idea. This is stealth, and stealing is plagiarism. That's why I had used the word kidnapping, how to avoid it. So going back to the original title, so you must have been surprised as to why we use that. That is the reason why we use it. So what is plagiarism? Plagiarism is submitting a paper you did not write yourself, copying from sources and pretending you wrote it yourself, using a source and saying it is a different source. You use author's ideas and words without giving that particular author credit. This is the main source of plagiarism. Why is plagiarism wrong? Well, any work that has been done well, and I'm emphasizing work that has been done well, requires effort, consistency, and time. It's not something that comes out of the blue or something that a person has suddenly discovered, or like a lightning it has struck him. It is not that. Stealing someone else's work of words, ideas, or effort is like stealing that person's property, which we call as intellectual property. And we know that intellectual property rights now matter a lot. And not only now, they have always mattered. So just like if you were to steal something, you were to kidnap somebody, is something equivalent to that, that intellectual property has been stolen. So why is plagiarism wrong? It's wrong for this reason, that somebody who has worked hard, put in a lot of effort, consistency, and time has had his work stolen. And nobody likes the theft of their goods or be a thief. So that is why plagiarism is wrong. And of course, we must suffer the consequences of being a thief. Being called a thief in intellectual work is often a career ender. You may be asked not to present a paper again. You may be blacklisted by journals, and you will find that entire good work which you may have done earlier gets negated by being in a particular article, ending up as a plagiarized work. So avoiding plagiarism is important. And for that, you have to understand what plagiarism is, understand what citation is, and appreciate the value of recognizing others' work. So your own original work is also recognized. So just imagine, if you recognize others' work, your original work would also be recognized. Otherwise, they'll say that this man has plagiarized, his original work may or may not be true. And how to avoid it? I've used and said, make clear who said, who thought what. Sometimes you use the exact same words as the author. Sometimes you paraphrase the author, but always you make clear which words and thoughts are authors and which are yours. There's even a taxonomy of plagiarism. In this, first is the plagiarism of ideas, in which, as I have mentioned earlier, the plagiarist sees an idea somewhere presented, and then he conducts research based on that idea and presents it as if it is his own work without acknowledgement of the source. Or, as I told you, then you have peer reviewers, or you have persons within your department who may take on that this is my work. Plagiarism of text is also known as the copy-paste or word-to-word writing. This occurs when a researcher takes an entire paragraph from another source and includes it in his own research writing. Even self-plagiarism. Now, this is something very interesting. If you use work, extracts from your work which has been published earlier, it is still considered plagiarism, because that work has been published, that work has been acknowledged in a journal, and you pick it up. You have to say that either it is part of a continuous therapy, as Dr. Rajiv just mentioned, that there is a study going on for the last 20 years, the PURE study, of which he is one of the prominent members, has been publishing articles of more than 100 articles, as he said. Then it becomes a continuum of a particular theme or a topic in which self-plagiarism would not be there. But even then, they would have to acknowledge that this work is a continuation of what was done earlier, and Dr. Salim Yusuf and Dr. Rajiv Gupta had mentioned it in an earlier presentation in any other journal. Then there is collusion, asking someone else to write a piece of work for the plagiarist, who then presents it as if it's his own. And there's even such a thing known as a patch writing. What is patch writing? Copying parts of another work and changing a few words here and there, or the order of words, to make it appear as if it is original. Now, where did I get this slide from? I got it from an article published elsewhere. I've given a reference there, in which they talked in detail about the plagiarism. So what are the writing conventions? The writing conventions say that when borrowing the author's exact same words, cite your author, use quotation marks around borrowed words. Even when you are paraphrasing the author's information, cite your author. And when you're reporting the author's information, cite your author. So you see the three words that have come in all these 3 points are cite your author, cite your author, cite your author. Now, when you are citing the author, giving the appropriate or the right acknowledgement to his work, then you would not be accused of plagiarism. But there is a rider to it. If you pick up an entire article, put quotation marks, and say that this is the work that has been done, and I agree with this, that would be severe plagiarism. It is not that you have quoted him and not written anything at all on your side except a few commas and full stops or ifs and buts. So that again comes in. Even by citing this does not make it your article. So you have to be very sure as to exactly what you are doing. The University Grants Commission has recommended penalties for the faculty members and for the postgraduates as to what to do if there are a lot of, if the plagiarism levels exceed a certain level. At level 1, the student will be asked to submit a revised script. At level 2, the student will be debarred from submitting a revised script for 1 year. And at level 3, the student registration for that program shall be cancelled. Now, it varies in various institutes, it varies with various journals as to how much is the percentage of plagiarism or the use of other person's work that is to be allowed. Broadly, it is around 10%, below which it is considered reasonable, all right. So you have some sentences which would be common, generic sort of sentences, or in the review of literature that work has come up, or the references have been included. So that also depends on how much and which part has been considered for plagiarism. That is, you may have the review of literature, which would be considered, but if your discussion, if your results, if your material methods are exactly what has been mentioned by others, then it would be a severe, something that requires a severe penalty. Now this again I have taken from the UGC notification. in which says promotion of academic integrity and prevention of plagiarism in higher education institutions regulations. Now, interestingly, entire softwares exist to help you cite properly. And there are several of them. So use the citation software as you write. Get used to citing the work properly as you write your research. Make a habit of storing citations in your research. Help the readers identify your new and original ideas clearly. It's a big table that I've seen here. It's not, I will not be reading it out, but these are the methods available to use the citation software. Or you can go the manual way, that you have taken the word from somewhere, you identify it as one, you put it in the references as one, then you go two. But with this new citation software, you can be very sure that your work will be accepted easily in wherever you send it for publication. And this again, I have taken from the comparison of reference management software. And this is a very useful tool. Some of it is paid, some of it is free, and some of it is quite complicated. But yes, this is what comes out, and it would be very useful for people who are writing serious papers and writing books or chapters in books. The final word for plagiarism is honesty. If you are honest in your thought, word, and deed, then plagiarism will not come into the picture. You must make your own ideas stand out. We're not talking of just writing out a paper for the sake of writing. That you'll be surprised that I have often received articles which are close to 60%, 70% plagiarized. We just send it back to the author. We don't even comment on that and tell them you have to rethink the whole thing. So honesty, honesty, honesty in your thought, your word and deed will make your ideas stand out. Never kidnap others' work, and your own work will not be kidnapped. Institutional mechanisms software exists to ensure the integrity of intellectual property, and you must be true to that. And I'm sure with whatever you have learned in the last 2 days, in the topics covered yesterday in the IMRAD, in the dummy session that you saw just now, what Dr. Rajiv Gupta talked to you about, the ethics of publication. And if you stay to that, true to that, you stay true to your own work, you will be a successful publisher. Thank you very much. Stop share.
Thank you, sir, for the presentation. It was a very crisp and excellent presentation. I think there are questions. Dr. Balota, do we have time for the questions? Or
I think let's finish maybe later on. Maybe Dr. Saxena can answer questions on the question box on the chat.
Okay, yes, sir.
Okay, am I permitted to start?
Yes, sir, definitely.
Thank you. So, like after
Sir, put it on a slideshow mode, full screen.
Slideshow. Two wonderful talks by Dr. Rajiv Gupta and Dr. Ganesh Saxena, and you know, these are giants in their field and teachers and mentors to several generation of undergraduates and postgraduates. And you know, we look up to them and their guidance for this, and you know, do great talks. So it's kind of difficult to follow these two giants, but I'll try and do my best. And in the next 15 odd minutes, I'll try and give you a flavor of how to select the right journal for your scientific manuscript. So this is what I'll do, give you a snapshot of understanding the world of publishing, you know, what Dr. Vinod and Dr. Molly and the editors, you know, what they face. Then maybe a little bit about open access, which is like really the publishing buzzword these days, why to publish, where to publish, how to deal with revisions, how to deal with rejection, and some, you know, not take home messages, some stay at home messages. So ladies and gentlemen, you know, getting a paper published is something like this. You have so many obstacles and your ultimate goal is to get your paper accepted. And you know, you have to start on this path and be ready to be bashed around quite a bit. And publishing a paper and finding that road is like climbing the summit of a big mountain. So you have several steps to do before you can get to the top. Now just understand, this was a publisher several years back, and this was the volume of work the poor chaps had to do. So, you as an author, you as a prospective author, have to reduce the work of these guys. The easiest for them is to dump it into the out file and not look at your paper again. It's not a physical paper now, it's on the computer, but still it is our job to make it as easy for them as possible, and that will help you in getting your paper in and published. Editors are usually known as shredders, and we have to believe that they are not shredders. They are very overworked, usually not paid academicians who volunteer their own time, their family time, and to look at the rubbish which we send them. So have a big sympathy bone for editors like Dr. Vinod Ravindra. So the scientific publications, this is a snapshot of the scientific publications. There are more than 2,000 publishers worldwide. This is a huge industry. Annual revenues in English language journals is $8 to $9 billion. This is the volume of work. And you can see these four disciplines, health sciences, life sciences, they form the chunk of articles which are published, which are submitted for publication. And some trends, worldwide, the articles published are increasing, and this is to 2005, and this graph is still going up like that. But one major change has happened. These red blocks are e-publications. So in 1997, when we were medical students with Dr. J.N. Saxena, everything was print publication. Then slowly, journals started to do print and electronic, and now a significant amount of work published, scientific work published, is only electronic without any print. There is a overlap, and there is a small chunk which is only print. The countries which lead the world in scientific publication, 2018 data, China tops everything, USA is next, India is not too bad at number 3. So each one of us has to contribute. We are about 5% of the global share. So, and being a huge country, 1.4 billion people, we have to, make sure that we increase this chunk of publication worldwide. Open access is a modality which is available to us now. Your article is universally and freely accessible via the internet. The authors remain the copyright of their article. It is deposited immediately upon publication, and it can be included in the database right away within a matter of days because of the electronic. So it is freely available on the internet. It is licensed to allow redistribution and reuse. However, it does get permanently archived in multiple international repositories. And why is open access important? So it's an online publishing environment. Nearly all the publishing costs of first copy cost of distribution is negligible. It's just there on the web or goes via email. And the researchers can share their research as widely as possible and really quickly as possible. And it eliminates access barriers in a natural way. Of course, there is fee for publication even in open access. And this usually covers the technical, editorial, production, the marketing costs and everything. And here are the snapshots of some of the publication fees. And they can be quite substantial in like the bigger, more prestigious publishers. Now, who pays for the publication fees? So usually it's from the author who pays out of grants. There can be other sources of funding, including institutions, and Dr. J.N. Saxena, as Director of Research of our institution, Mahatma Gandhi Medical College Hospital and University, he is looking at partial institutional funding for authors who have managed to break into the good publishers. So why to publish? You know that to get funding, to get promoted, to get a job, to keep your job, and sometimes to get a girlfriend or a boyfriend. And you're pretty familiar with this, publish or perish. Is being enforced in our country now also. If you want a promotion, you have to have an X amount of articles published in good places. So publish or perish does hold true and is becoming even truer in our country. So where to publish? Again, knowing where to send your article is one of the key aspects of a successful publication. So you have to first identify your audience. You have to verify their interest in the topic. Say, for example, you are doing a knockdown of MDR1 in HK cells, and you are submitting to a German journal related to industries, your article is obviously going to be rejected. Then determine the range of interest, local versus international. You've done a study of bioavailability of ibuprofen in southern Kosovo, and you're sending to an international journal. Obviously, it's going to be shot down. Then how to select a journal? The important things are look at the references. This will help you narrow down your choices. And you also look at recent publications of each candidate in the journal, find out the hot topics, the accepted type of articles, and ask yourself these following questions. Is the journal peer reviewed? Who is this journal's audience? What is the average time to print? What is the journal's impact factor? And then, shortlist to one journal. You can never submit simultaneously articles to multiple journals. It should never be done. So choosing the right journal can be a very difficult process and a crucial process in getting your research work accepted for publication. And you have to very carefully balance the right journal. If you choose a journal which is extremely stringently peer reviewed, and your study is not of sufficient quality on impact, then a rejection may lead to dismotivation, motivation. And if you publish it to a smaller journal, then the reach of the journal may not be what you're looking for. So these are some of the criteria which you must consider when choosing the right journal. The criteria to consider: impact factor, open access, and tools to identify journals to publish in. So some of the criteria which you should evaluate regarding a journal, whether the journal is used by yourself, mentors, advisors, colleagues, type of articles published, original articles, review cases, case studies, length of the manuscript, what supplementary data do they want. Then you could also look at number of years in publication, costs and availability, open access or print or both, peer review status, and impact factor. So all of you are aware about the, you can gauge the reputation of the journal, the acceptance, rejection rates. These are available from most journals if you search for it. The quality of accepted articles and authors, the audience of the journal, the readership, and the audience size, indexing, and circulation. And the review process is also important. If the journal takes a year and a half to publish, then you may not be interested to go to that journal. And of course, the publication costs also should be considered. If the journal has a publication cost of say $5,000, it may be out of your reach to try and do the effort to get into that journal. Impact factor, all of you know the impact factor. It reflects the average number of citations to recent articles published in that journal. It is a measure of relative importance of a journal within its field. The higher the impact factor, the more important the journal is. And there are ways and means by which the publishers and the publishing houses calculate the impact factor. And these impact factors are very easily available on the internet. You can very easily search for these impact factors for the journal. So New England Journal is one of the journals which has the highest impact factor of 47. This was some years back, could have gone up even more. The Indian Journal of Medical Research is one of the journals which has a very significant impact factor, one of the Indian journals. So how to identify high impact journals in your field? Again, you can do it very easily. There is this website where you can search at JCR journal citation reports, and this can very scientifically give you categories of the journal if you're wanting to look at geosciences, and then you can look at all the journals on geosciences, and their impact factors can be available to you at the click of a button. So you can see the impact factor of these. So this is a good website to search for impact factors. Then, in addition to the impact factor, there are other factors also which are important, and some of them are listed over here. Yeah, this is the eigenfactor score, and again, some people like to use this. And then you have some other rankings, the Scopus ranking, the IPP, the SNP, and all of these, are important, and you could think of these when choosing the journal you want to send to. So, are there any tools to help you identify the journals to publish in? Once you have your abstract and your title ready, of course, you have that after what Dr. Vinod and his team have been teaching you for 2 days. This is an extremely good website known as JANE. JANE stands for Journal Author Name and Estimator. And it's very easily available on the internet. This is what the welcome page of JANE looks like. You have a box over here where you can insert the title and or the abstract of your research work. I've inserted this like PPAR gamma agonists in combination with BCR-ABL TKI in patients of CML, and I find journals, click on find journals, and it will give me a list of journals where I could send. It could tell me that this journal is not of English language. It could also tell me the impact factor and article influence. And then out of this, I could very easily choose that my research work has a good chance of being accepted in, say, leukemia, lymphoma, or leukemia, very little chance of being accepted in blood. And you can choose your journals by going to this website. You also need to be careful that you don't send to a predatory journal. There are lots of predatory journals, available there. They've been mushrooming since the MCI has made publication compulsory. You send the paper to them today, they will charge you X amount of money. They will publish it tomorrow. So these are all predatory journals, and you can on the internet find a list. This is known as the Bial's list. Bial was a librarian in the United States, and he spent his whole life in identifying these predatory journals. Other people are continuing his work. And then before you submit your article for publication, please make sure that the journal which you've selected is not on Bial's list. So you can pick out predatory journals, and you should avoid sending your research work to any one of these. So now, what about revisions? How do you handle revisions? Very quickly, I'll do that. It is very rare to find comments like this. On the whole, I found it quite marvelous and yet desperately awful at the same time, apart from mediocre bits. So you very, very rarely have erratic editors or reviewers, and these are the exception and not the rule. So if sometimes some journals ask you to choose the reviewer, like author suggested reviewers, and the rejection rate is in these journals, when you choose the reviewers, is always lesser than when the editor chooses the reviewer. So by and large, journals in which the editor chooses the reviewer, you get a better quality of articles. So if your paper is returned for revision, you are in good company. This has happened from Albert Einstein to the present Nobel Prize winner in medicine, Dr. Jameson. it's okay to get mad, but don't act on it. Try to understand what the reviewers are really saying. If the reviewers did not understand your work, it is clearly because you did not present it clearly in the first place. So that is what you have to fix and modify. And you have to look for clues from the editor, who is the final authority in deciding whether to publish or not to publish. And they will tell you very clearly whether you need to rewrite, whether you need to do more experiments. Sometimes you're asked to do additional experiments. And whenever you are submitting a review, please make sure that you do it in a point by point fashion. You should resist the temptation to prepare an impassionated emotional response if you don't agree to the reviewer's comments. But if you feel that you're right, then you do need to stand firm, but you need to do it diplomatically, because it takes 1 5-second read of your comment for the reviewer to reject. And you must thank the editors and the reviewers for doing this fantastic job which they do on a voluntary basis. And hats off to this extra work which these guys do on our behalf. So you have to be responsive to the reviewers. You have to make it clear for them to understand what revisions you've done. If you make a complicated review and submit again, and if the reviewer doesn't understand, he'll just reject it outright. He's not going to spend time on that. Now, rejections also happen to everybody. It has happened to the best of the best in the field. The best thing is not to take it personally and honestly assess your work. This is something which is important. This is what Newton discovered. This is something which has high impact, but you are, substituting apples with oranges. So obviously this is not as of the same effect as this. This will be a low impact research. So you have to be very honest in assessing your work, or you could ask your teacher or mentor to do this, have another opinion, and then, major reasons for rejection are inappropriateness of the journal. You have to do more homework and send to an appropriate, more fit journal. Most of the works which are rejected are merely confirmatory or incremental, and there's nothing new in that, and that's what the editor writes to you. Sometimes the work is poorly designed or inconclusive, so you need to focus on your hypothesis. And most commonly, it is poorly written. And if you follow the advice of Dr. Vinod and his team, which they have given to you over these 2 days, then this at least this reason for rejection can be eliminated. Great science in an ugly package can still be rejected. So if you have done great science, make your package also very attractive. So these are the reasons, most common reasons for rejection: submission of papers which are clearly out of scope of the journal, failure to format the paper according to the guide to the authors, inappropriately suggested reviewers, inadequate response to reviewers, inadequate standard of English, and resubmission of rejected manuscript without revision. So these are the most common causes of rejection, and these are all very easy and simple to avoid. So I think I'm not going to spend time on this. The most important thing is that if you give up, there is no chance of success. So don't give up, keep trying, keep making the appropriate revisions, and then you will get your paper in the journal which it deserves to be. So my sit-at-home messages to you is: read many papers, learn from good ones and bad ones, write frequently. Quality is everything. Review frequently. Learn to be objective about your work. Believe that editors and viewers are likely trying to be objective about your work. Learn to expect and accept rejections. Then ingredients of good science: novelty, comprehensive review, strong data, a thought-provoking discussion, ingredients of good writing, good organization, appropriate use of tables and figures, right length, right audience, and right selection of journal. And this you've already heard over the past day and a half, and I hope that has helped you. So ladies and gentlemen, there is no way to get experience except through experience. So keep writing, keep trying, and keep succeeding. Failure is part and parcel of success. Thank you very much. With that, I stop my presentation. Back to you, Aparna.
Thank you, sir, for the informative lecture. May I now request I guess there are no questions for you, sir.
Please
Thank-
go ahead.
I request Dr. Ravindra to please give us the take-home messages for the workshop.
Me?
Yeah.
Oh, okay. Thank you. I would like to thank Rajiv Gupta sir, Saxena sir, Malhotra sir for their excellent talk. And it was really fantastic way to sum up the whole evening. And in fact, the entire workshop, that even with best of the writing, if you're not careful about the authorship, if you're not clear about the ethical misconducts, choosing the right journal, how to avoid predatory journals so that you do not end up wasting your time. And also, of course, the plagiarism. This was really very good. I would just, coming to the dummy manuscript, there were 8 outright rejection recommendations, 20 major revision, and 3 minor revision. So I think, all the delegates who gave the opinion here and also in the emails, I would like to thank them and congratulate them for having done a wonderful peer review of this dummy manuscript. One of the, as it was mentioned in several different talks today, one of the challenges we face, especially in the manuscripts coming from India, is constant sort of bickering about the authorship. So I would once again like to highlight that the ICMGA criteria for the authorship, there are 4 criteria and they are all and criteria. Means you have to confirm to each and every of the 4 criteria to be an author. And the last one, the 4th one, is in fact actually the most important, that as an author, you had to be able to guarantee the sort of genuineness or the ethical conduct of the whole research. So change in authorship, and later complaints that how could this person be an author, or can this person become an author? It's a constant source of sort of a drain on the editor's time. So be careful about that. So I would like to thank all the delegates, first of all, for their enthusiasm, keenness to attend this workshop, and all the faculty, senior faculty, Saxena sir, Rajiv sir, Malhotra sir, and wonderful comparing by and timekeeping by Aparna ma'am, and all my brilliant, keen, and really sort of on the ball faculty, and it's been really great. So I would like to thank everyone and wish them a very happy rest of the evening. Thank you.
Thank you, sir, for your words of encouragement. Now I invite Dr. G.N. Saxena to give the vote of thanks. Dr. Saxena.
Well, Dr. Vinod has already mentioned the persons and the key take-home messages from here. Well, it has been 2 days of intense activity on paper writing, and the number of participants has been phenomenal. Now, if at least 50% of them are able to follow what has been said, what has been told, or since this will be put up on the website also, they can relook, have a look at that, and try to present better papers. The acceptance rate will go up tremendously, which will benefit them as individuals. And interestingly, it will also benefit the institution where they are working. And once the institution benefits, then the rest of it is something like a rising tide, where everybody, all the boats rise higher. So follow the principles that have been mentioned here, try to stick to them. And as I mentioned in my slide, try to be honest to your own work, and that will help in others. So I'm thankful to Professor Malhotra for having organized this workshop along with Dr. Vinod Ravindran. Both of them have been colleagues at one time or the other, and Dr. Malhotra is still my colleague here. Vinod has often been in touch. Lovely talking to you again, Vinod. And your team, you have a very interesting team. They have worked hard on their presentations, and I'm sure we'll have more such interactions in the maybe few weeks or few months time in any format, maybe in the same format or maybe in a modified format. So thank you everybody for continuing and being still present at this late hour. I wish you all the best.
You should have thanked the program coordinator also.
That of course, she is the anchor. Sorry, my mistake.
No, that's okay, sir. So we come to an end of the session for the 2 days workshop. Do I need to summarize everything? Because now it has been summarized multiple times.
No, no. I think no, you can sort of,
No, it's already been okay. I'll just put up the highlights, what has been said by the eminent speakers. The first topic today was this identification. The first topic was editorial process and tips for successful publication. Again, here the main content or the main point was selection of the right journal. That is the key for the successful publication. Your choice changes, the selection criteria changes, and your paper may not be published, and your entire effort is going to be wasted. And that sir has already said how you have to revise, you have to receive the rejection, you have to accept the rejection, and also accept it in a very humble and in a very polite manner, which is now in the dim light, which is not acceptable by us everywhere. He has again emphasized on the George Orwell's principles of effective writing. And the most important point which sir has mentioned is have a local peer review before submitting it to a journal for a specialization or for the final publication. So thank you, sir, for all your ideas and for all your suggestions. We hope that the audience incorporate them in their presentations, and we will have a wonderful publications, and they are happy to have it with for their progress. Coming to the panel discussion, the dummy manuscript which was dissected to its maximum core was very much interestingly highlighted and revised by the panel at the galaxy of speakers, and very rightly the audience has understood, and we got the responses as sir has already given us. So a big round of applause to all the panel of speakers who have dissected and who have given us the right way of analyzing a manuscript. Coming to the next topic by Dr. Rajiv Gupta, publication ethics and authorship. This is the most important point because authorship is there. There is a hold of being the author to the publication or to the manuscript which is not theirs. So Dr. Rajiv Gupta has rightly given us the criteria and eligibility guidelines to author any of the manuscript which is going for publication. Now it is more essential to have it documented because now many of the journals are authorizing it and receiving the documentations from what is the idea and what was the contribution of each and every author for the authorship in that publication or in the manuscript. The second last topic, plagiarism. Sir started on a very light note about being kidnapped. Sir, we do not kidnap people. We do not kidnap ideas. लखनऊ से तो लोगों को बंदूक की नोक पे उठा लिया जाता है, so that's not kidnapping. So ideas are here just stolen. Obviously, ideas when they are stolen, they are becoming plagiarized. Stealing of ideas and stealing of words. These are the two key points in plagiarism, which sir has emphasized very much. He has also touched the topic of intellectual property rights, which is mattering a lot nowadays. And sir has, I think so, scared everybody properly by saying that if you are plagiarized, you'll be blacklisted and you will have a career end and your career may be on the decline and you may come under scrutiny so that you are not allowed to publish any more articles and you are not allowed to author the other manuscripts if you have. The new term which we gave was the taxonomy of plagiarism. That was a wonderful slide, sir, which we didn't even know existed. So thanks for that slide. And in the end, yes, definitely everybody will be honest in their thoughts, words, and deeds as suggested by you so that there is no more plagiarism for any manuscripts. To the last presentation by Dr. Hemant, sir. he has given us the ideas about how to choose the right journal. The criteria he has very clearly mentioned that it should be cost effective, it should be available, it should be a journal of reputation, there should be a good rejection rate, there should be indexing, there should be citation index. The criteria are that they allow you to give you supplementary data. It is journal previews, and the most important is the impact factor. There were tools for identification also cited by him. There was a website given for the journal citation rate. Then Sir has also given us a word of caution against predatory journals. The journals which give you the assurance that your article will be published in a day or two and you get it published, but that is not true because the citation index or the genuineness of that journal is at doubt. This was, Sir has again mentioned of the BL's list, which gives you the list of the predatory journals. Sir again has told us how to handle the rejections, how to handle the revisions of any articles. I guess that was all about the presentations for today. And yesterday's presentation were also very good on the IMRAD concepts. I invite Sir for the closing of the ceremony, Dr. Hemant Malhotra, sir.
Thank you, Dr. Aparna, for conducting this workshop very well, and most sincere thanks to Vinod and his team. Each one of them have been wonderful, and hats off to you for being editors of so many 2, 3, 4 journals. I'm very aware of how much hard work and time it takes. And for the attendees for attending this workshop for 2 days, all of you who attended will be provided certificates. They'll be emailed to you, and the proceedings of this workshop, the recordings, will be available at the Mahatma Gandhi University website. So if you need to refresh something or listen to a talk again, then you will be able to do that in maybe a week's time. And like it's all good things also come to an end. So we're ending this hopefully good workshop. And once again, thanks to everybody. Thanks to Dr. Saxena for his support always. He is the Dean of Research, and everything has to be recruited through him. Our Vice Chancellor, Dr. Sunil Sachdev, is very supportive of all academic activities, as is our Chairman, Dr. Vikas Swartkar, and our Emeritus Chairman, Dr. M.L. Swartkar. So we will continue to do activities like this, and so as they say, please watch this space. So have a great weekend, and thank you very much for watching.
Thank you very much, sir. Thank you.
Thank you so much, sir.
Thank you. Thank you. Good night. Thank you very much.
Bye. Good night.
Bye-bye.
Good night. Thank you, sir.
Bye.
Yes, sir.
Thank you, sir.
Mm-hmm.